Okay, hello everybody and welcome. Thank you for joining us for today's call. We're so happy you're here. This is the ESRD Network Learning and Action Series focusing on transplant quality improvement activity. I am Stephanie Hall. I'll be your host for today. I want to go over a few reminders before we get into the presentation. We have migrated this year to a different platform than we had last year, so a few things may look a little different. I do want to go over them. One is we get a lot of questions about the CEUs, and I will go over at the end of the presentation again about how to obtain our CEUs at the end of this presentation. Today we are streaming the audio over the computer speakers to free up the phone lines in your facility. If you need to dial in from your phone, send us a message and we will be able to assist you. If you're having trouble, if there's echoing, echo is usually caused by multiple connections to a single event, so close all but one of your browser tabs. And we do have, like I said, limited phone lines available. If you absolutely cannot stream these via your computer, please request a dial-in line via the Ask the Question box. There is some troubleshooting for your audio. If the audio from your computer speakers are breaking up or the audio suddenly stops, you can either click your refresh button located up in the top left-hand corner of your computer in the toolbar, or you can press the F5 button on the top row of your keyboard. Either one of those functions would be able to help with some of the audio issues. When submitting a question, type your question in the Ask a Question section located on the left-hand side of your screen. In order to reduce the background noise, all the phones are on mute, so we do want to hear from you, so please submit your questions or any comments in the Ask a Question section. The event is being recorded and all the material will be available from your network representative within 10 business days. Again, this event is approved for one CEU, and I will go over again at the end of the presentation how to obtain those CEUs. So what are we doing here today? What's the reason for participating in today's LAN? Today you're going to learn about the function and resources of the National Patient and Family Engagement Affinity Group. We're going to ask that you spread these best practices from today's LAN. We're going to ask that you listen and share your approaches and experiences via the chat. Identify how this shared information could be used at your facility, and then apply at least one idea from today's LAN call at your facility. We also ask that you, as you're listening, that you will be able to identify and implement one action item from this meeting that can directly increase the number of patients on the transplant wait list. Many of you took the pre-work questions that was sent out. There were two questions polling questions that we had, and I'm going to share with you the results. There were 468 participants. The first question, are you aware of the role of the ESRD NCC National Patient and Family Engagement Learning and Action Network? Out of the 468, there were about 60% said yes, they are familiar with the NCC NPFE LAN, and 40% said no, they are not familiar with it. The second question, have you ever used a resource created by the ESRD NCC NPF LAN? And out of the 468, almost 33% said yes, they've used some resources, but 67 said no, they have not used the resources. So I'm going to introduce our speakers. We have two today. I'm going to introduce both of them. Timmy Nelson, a former kidney transplant affinity group subject matter expert, was involved with the development of the Partnering Along the Road to Transplant handout. Mr. Nelson volunteered with the National Patient and Family Engagement LAN for 3 years. We also have Jerome Bailey. He's the Associate Director of Patient and Family Engagement for the ESRD NCC. Mr. Bailey has been instrumental in forging new pathways for patients to remain connected in the virtual LAN and providing multiple avenues for patients to share their perspectives. I'm going to go ahead and turn over the presentation to Jerome.
All right, thank you, Stephanie. The NPFE LAN team is happy to be here today to talk to you about the work of the LAN, specifically the work of the NPFE LAN Transplant Affinity Group. Next slide, please. Here's a look at what we will do on today's call. We'll discuss the definition of a LAN. We'll explain how the affinity groups support the LAN. We'll share the vision and goals of the LAN and affinity groups. We'll review the Kidney Transplant Affinity Group developed resource. And as you mentioned, we'll hear from a Kidney Transplant Affinity Group patient subject matter expert. Next slide. For those of you on the WebEx, this is the NPFE LAN team. I'm Jerome Bailey, and Kim Buettner is my partner. Our CMS NPFE LAN subject matter expert is Jaquintia Polk. With CMS direction and support, Kim and I work with patients and caregivers from the 18 ESRD networks to develop resources to enhance the quality of care of patients across the country. Next slide. And you can actually go through these next couple of slides pretty quickly. Here are some of the NPFE LAN SMEs that we work with. They are a very diverse group of individuals. They come from different social, economical, and educational backgrounds. The SMEs serve a 2-year term and then are able to transition to become a legacy SME. We transition SMEs off the LAN to allow for new patients and new ideas to come into our work. Next slide, please. So, what is the NPFE LAN? The NPFE LAN is a group of patients, caregivers, and healthcare professionals who work together to make healthcare better for kidney patients. There are more than 90 SMEs nominated to be a part of the NPFE LAN. They represent the 18 ESRD networks, which cover all 50 states and U.S. territories, such as the U.S. Virgin Islands, Puerto Rico, and Guam. All treatment modalities are part of the LAN. So, what's the goal of the LAN? LANs value the knowledge that members bring to the group and use the information and ideas shared by members to make improvements quickly through many small changes. These small, quick improvements can add up to make a big difference in the lives of kidney patients. We foster an all-teach, all-learn environment. The patients and family members that are part of the NPFE LAN develop resources to help support the network quality improvement activities. The NPFE LAN shares best practices and supports the spread of resources to ESRD networks, dialysis facilities, transplant centers, and renal community advocacy groups. Next slide. As part of the work of the LAN, we work to identify quality improvement activity resources, adapt resources for patients and caregiver use. We share resources with ESRD networks and community partners. We request networks to share the resources with their facilities. We ask SMEs to share resources at their facilities, discover partnerships with kidney community stakeholders, and we spread the resources through collaboration, social media, and website postings. Next slide, please. The CMS ESRD Network program has 4 broad goals. They are to empower patients to make decisions about their health care, usher in a new era of state flexibility and local leadership, support innovative approaches to improve quality, accessibility, and affordability, and improve the CMS customer experience. All the ESRD networks work on quality improvement activities that address these broad goals. All the quality improvement activities need to incorporate the patient and family member ideas. We count on patients and family members to share their ideas within the LAN. Next slide, please. So within the LAN, there are smaller groups called affinity groups. These groups work collaboratively to promote communication, choice, and respect They build on the group's individual and collective strength. They encourage patient caregiver SMEs to share their valuable perspectives and ideas to improve the quality of care for all ESRD patients. And they promote an all-teach and all-learn environment to develop resources and materials that are ultimately put into action and shared beyond the land itself. Next slide. This year, the NPFE LAN, in conjunction with the ESRD networks, is supporting 3 areas of focus for CMS: reducing bloodstream infections, increasing the number of patients dialyzing at home, and increasing the number of patients getting transplant. There is also a patient-selected topic group. In 2019, the affinity group chose to focus on helping patients and caregivers improve their emotional well-being. We will be working with the patient-selected topic affinity group to settle on a focus for 2020. Stephanie?
All right, we have our first polling question we're going to put out to the audience. Let me just put this out here. All right, so I just sent it out. What do patients cite as being the reason for not wanting to get a transplant? So I'll just give everybody a little bit of time to answer that and submit those answers. And we're getting quite a few in here now, so I'll keep the poll open just a little bit longer. And we'll close the poll up here in 3, 2, and 1. So I'm going to end that, and I'm going to send the results out. So what do patients cite as being the reason for not wanting to get a transplant? 20% said the prescription drug cost. 30% said fear of surgery. 33 and a third said lack of knowledge about the process, and around 18% said no donor. So very good. Let me just close this out and we'll go back to the slides. Jerome?
Thank you very much. So here's a look at what the Kidney Transplant Affinity Group told us. They told us that they wanted to develop a resource to help improve communication between the patient and his or her healthcare team. They told us that they wanted to create statements to inspire discussion between patients and healthcare professionals about kidney transplant options. They told us that they wanted to educate their healthcare team about their healthcare goals as well as their personal goals. And then they told us that they wanted to partner with their healthcare team to get on the transplant wait list. Next slide. So the Kidney Transplant Affinity Group created a resource designed to facilitate meaningful conversation with their healthcare team. The SMEs noted that when the healthcare team has an established rapport with patients and family members, they will be more likely to share goals about their quality of life. This information can be used by healthcare professionals to better frame conversations about kidney transplant as a treatment option. To assist with establishing this type of rapport, the Affinity Group developed Partnering Along the Road to Transplant, a resource detailing 5 key steps or concepts to effective communication between patients and healthcare professionals. The 5 key concepts to better communication between patients and healthcare providers, as outlined by the members of the Kidney Transplant Affinity Group, are getting to know me, making sure I understand what you're telling me, include my family in the discussion, connect me to others, including other patients, educational resources, support groups, and guide me to all of my treatment options. I think you all can see from the front of the resource is basically a diagram of the steps that I just outlined, and then on the back of the resource is an explanation of each of the steps. And so again, all of this came from the feedback that we received from the SMEs that are a part of the Kidney Transplant Affinity Group. And I will pause for a moment to hand the call back over to Stephanie.
Thanks, Jerome. Yeah, we have our second polling question. Let me pull that up and get that sent out. So what do patients cite? Oops, let's get the second one out here. Now let's send it out. Said, who do you think is the best person to talk to patients about their transplant options? So I sent that out to all the participants, and we'll give them a little bit of time to submit their answers. So they're starting to come in right now. We've got about 500 people, have 600. We'll just give it a few more seconds, and I think I'll close the polling in 3, 2, and 1. So let me send out the results to everybody, and then let's review them. So what do you think is the best? Who do you think is the best person to talk to patients about the transplant options? Almost 45% said the nephrologist, 9% said the nurse, almost 30% said the social worker, and about 18% said the transplant patient. Get back to the slides, and then I'm going to give it back over to Jerome.
Yes, I'd now like to introduce our patient SME, Timmy Nelson. Timmy is from ESRD Network 4. He was a member of the NPFE LAN for 3 years and is now a legacy SME. Timmy has worked with the NCC on numerous resources, and he has shared, today he's going to talk about his involvement in the creation of the Partnering Along the Road to Transplant resource, as well as how he has shared the resources with members of his community. Hi, Timmy.
Hi, Jerome. Jerome, thanks for that. I appreciate that. Just to give you all an idea of why I'm involved in the things that I do with this resource specifically, I want to take just a moment and share my background and my journey, if you would, with the ESRD and transplant. January 2013, I was diagnosed with ESRD. Then April, I was notified that I was at stage 4. And then at that conversation, my nephrologist and I had a very strong heart-to-heart talk, and we talked about dialysis, and we talked about PD being the best source for me. But then the thing that my nephrologist stressed to me is that he said the ultimate goal really is for you to get a transplant. So we're going to go through all these other steps, keeping in mind that our ultimate goal is to attempt to get you a transplant. So my focal point was transplant from the moment that I realized I had ESRD. And it came to fruition. In July of 2017, I was transplanted. In the spring of 2018, I started working with Network 4, and they allowed me the opportunity to go out and visit dialysis facilities to talk to patients on topics about home modalities and also preparation for transplant. So thus far, I've been fortunate to complete numerous lobby, or as we call them, education days on these topics, both in Pennsylvania and in Delaware, because I do live in the Philadelphia area. And so I've spoken with literally hundreds of patients and also a large number of facility staff members. Now, my reason for visiting facilities was and continues to be is to represent, that face of hope for those living in the world of ESRD, including those waiting for a transplant. And the reason why is that I vividly remember, the fear, the uncertainty, the anguish sometimes of going through this process and the uncertainty of not knowing what's going to happen. So my hope was to be able to talk to patients face to face and share with them that I can represent that process can and does work. So when I talk to patients, one thing I want to share with you also is that I always share with patients that this is a dual responsibility issue. And the dual responsibility for the patients at a minimum is to make sure that they advocate for themselves, so talk with the medical providers. I also insist that they have to adhere to their prescription for dialysis, their diet also, and then also to maintain the best possible health. So when that time comes, they're ready. So today I'd like to share with you this resource. Stephanie, if we go back to slide 15, I'd appreciate that, please.
Sure.
I want to share this resource that we developed with the SMEs, patients like myself, all over the 18 networks, with the support and the guidance from Jerome and Kim and the NCC staff. And this topic, as you see, is called Partnering Along the Road to Transplant. If you notice, it's very colorful, and it's too small possibly to see, but we also made a focus of having a multicultural focus, and both genders are represented on this map also. So when you see it up close, you see what I'm referring to. But this roadmap guides patients by using the main steps of coaching and counseling toward a possible transplant. So it provides a visually pleasant diagram. And on the first side, it focuses on the key steps with the intent of improving communication about the process for patients, caregivers, and also healthcare staff. As Jerome mentioned earlier, if you start in the bottom left-hand corner where it's yellowish or goldish, the first step is for the patient to get to know me. And then, but also for the healthcare provider, we're asking that the healthcare provider talk to patients and encourage them to share with the healthcare provider what's important to you as a patient. As you go up the road, the patient's portion is to make sure I understand and use the teach-back method to ensure that I understand what you're talking about. But then for the healthcare provider also, we want to encourage patients to ask questions on things they don't understand. Up further road, the patient says, include my family, my caregiver in the process. And as healthcare providers, we want to encourage people to bring someone with them because it's obvious that if you have another person there, the hope is they can retain additional information and have deeper conversations when the patient goes back home. On the top, it talks about the patient wants to connect me with others that understand this process, have possibly been through the process. But then for the caregiver or for the provider is we want the patients also to ask about support groups or local group services. So it's a two-way street. And then finally, the patient we want you to guide us to be part of the healthcare team. So let me be part of the healthcare team so I have some involvement in the process. And of course, as healthcare providers, you want the patients to take an active role in their care. Now, the other side, as Jerome referred to, it talks about the key points to help start a discussion on transplant. And that's designed for the key points for patients on one side and also key points for the healthcare provider to help guide that conversation. And the color coding matches what's on the front of it. Now, we all know that sharing information, visual aids, along with conversation are more impactful and longer lasting and more meaningful. So that's why I enjoy using this resource with patients, caregivers, and as I mentioned, also to help enlighten staff on the process. When this process initially came out in June of last year, I took the initiative to take it out, and I talked with at 5 facilities. I talked with 86 patients, and we talked about how this roadmap can assist them toward getting better communication. So what I gleaned from using this resource is that of those 86 patients I talked to, 41 of them and their caregivers expressed a strong interest in getting additional information. And so my thought is this helped open that gateway, but it also becomes a resource for dialysis staff to use and to refer back to when they're talking with patients. And once again, this being a handout like this, it's a tool the patients can take home with them, and hopefully between them, their family, their caregivers, have additional questions and come back ready to ask additional questions about the transplant process. So the goal of communication can be enhanced, and in my opinion, with the beta test that I did, has been enhanced by using this tool. That's it for now, Jerome.
Thank you, Timmy. All right, Stephanie, I will allow you to take over.
Thank you. And we do have a lot of questions that have been coming in, and please continue to submit any questions to Timmy or Jerome. But I think we'll go ahead and get started on some of those. So let me get to those. And Timmy, I'm happy to say probably a lot of them are going to be for you, but so we'll get started. First question here says, does any clinic incorporate a peer support program, especially for new patients that would benefit from a mock tutorial of the fundamental mechanics of the hemodialysis machine, commitment to definitions or explanations?
And I can say yes to that question. A number of facilities I visited, not all, but a number, and the number continues to increase also, have mock setups for home dialysis. And in fact, when we do our education lobby days, we strive to, on Network 4, to have someone from a facility, a home facility, to be with me as a patient or my partner, Diana, as a patient, to be there to talk about the technicalities and the use of those machines. So yes, many of them do, and more are doing so now. And I guess that highlights, it's a highlight with patients because they get a chance to see, touch, and hear from the professionals how that machine works, and so it takes away the concern of, can I do this at home?
Right. Good. Great. Next question, I'll go ahead and answer that. Just someone has asked, Carl has asked, will this PowerPoint presentation be mailed out to us? And again, all the materials, the PowerPoint will be mailed out to the networks in 10 business days, and then the networks will be sending it out to all the facilities. And it says, can you please share the link to the Partnering Along the Road to Transplant resource? Jerome, we can,
yeah, definitely.
On that now?
Actually, that is the wrong link that we put up there. But I will be able, I'll share with you, Stephanie, and as you are sharing the resources with all the attendees, you can include the correct link.
Okay, make sure we'll get that out then when we send out all the other post-event materials. Thank you. Again, a question for Timmy. Did you set up a table in the lobby and or were you able to go chairside to speak to patients that were interested?
And that depends on the facility. Different facilities have different guidelines. In some cases, I'm in the lobby, and yes, I do have a display set up in the lobby. Some cases I'm in the lobby, and some facilities, they have allowed me to go chairside and talk one-on-one with patients. And just to add to that question, and I'll be real frank with it, when I'm allowed to talk to patients one-on-one, it gives me an opportunity to have a more in-depth conversation with them and answer their questions versus being in a lobby where it's a group setting, if you would, in many cases. And so whatever works for your facility, it's one of those things where I'm happy to do either one, and my partner Diana on the west side of the state does the same thing. Whatever works for your facility, we're happy to do. But the more we can have that personal conversation with the patients and talk about our experience going through transplant, the more effective it seems to be.
Great, thank you. Another question here, Timmy. We have transplanted patients interested in working with our PD patients. How can they be trained to be a transplant mentor?
You know what? That's a conversation I think I'm going to defer to my folks at the network with, Network 4, and I'd be happy to be a part of that conversation. But we've put some guidelines together where we can share the tools we've used and how we've trained myself and my partner Diana to go out and talk with patients to make sure that we stay within all the regulatory guidelines. So that's a conversation I think we should have with my partners at Network 4, and we can talk and share with you the details that we have and how we've done the process.
Go ahead, Timmy.
No, I'll just say, but it works very effectively because what you're doing is you're empowering patients to share their stories for the most part, and that's what most patients want to hear because they're getting the technicalities from their nephrologist and from the staff at the facility, the transplant facilities, and what have you. But when they can hear coming from a patient and what they're finding, and I've had patients tell me this. You're telling me the same thing that the doctors told me. Well, yeah, because it's true. This is how the process works. You have to understand this is something people are skeptical of because it's an invasive process, and people are concerned about how accurate it is what they're being told. But when they hear from a patient, it just impacts even more so what you all are telling them in the facilities.
Great, and thank you. I was going to add to just that, I encourage everybody to contact their network. They probably have some peer mentoring or transplant mentoring programs already in place. You can also visit our ESRD NCC website. We have some guidelines and suggestions also, but yes, thank you. All right, let's see what else we have. So, are there any other options available for post-transplant caregiver requirement if a patient does not have family or a friend to do it?
I'll defer that one back to you guys.
Jerome, do you know of for caregiver?
No, no. What we've been working with is that's a topic that our affinity group has not tackled just yet.
Okay.
But I do understand that some of the networks are have a caregiver focus, and so you know, that person who asked the question may want to reach out to their ESRD network to see if there are resources available that they can share.
Correct. Great. Thank you. I think probably, Jerome, this is a question for you. Does each network have a patient SME?
So at the beginning of each year, each network, each of the 18 networks nominate 5 SMEs to be a part of the NPFE LAN. And so all of the networks can have up to 5. If you have a patient that may be interested or that you think would be good to be a part of the NPFE LAN, just send their name and contact information to their ESRD network, and they could become a member of the network PAC, which I believe is how Timmy started his journey as a member of the network PAC, and then from there he was nominated to join the national NPFE LAN.
That's correct,
Okay.
Jerome.
Okay. Let's see. I've got. Let me look. So let me see here. How many patients ESRD diagnosed are aware or have spoken to their nephrologist about needing dialysis before they are sent to a modalities class? When they are told to attend a class regarding modalities, how many of the patients can state the reasons they are in the class? Timmy, do you have any insight about that?
Well, I don't have any hard numbers, but I can tell you from my experience in talking to patients, based on what patients are telling me, when I go to the facilities and talk to them and share with them modalities or information about transplant, in most cases, they seem to not know much about either one of those. And so I get the impression from talking to patients, and I've had patients actually tell me they didn't know. Now, I'm going to add a caveat to that, and this is from the person. I know that when I was first diagnosed and I was first told I had ESRD, I had a complete meltdown at first. And so a lot of things that I was told maybe had to be told more than once. And so I would suggest that it's very important to reach and repeat when you talk to patients about things, because from this viewpoint, you have to understand that we've just been told we have an expiration date if something doesn't change. And so our ability to retain information may be limited at that point in time, which is why when I talk to facilities, I ask them to continue to repeat the same information sometimes, because sometimes patients don't retain that because they're in shock of what just happened. So, but those are the comments patients tell me, and I go with it from there. So.
Great,
And Stephanie, we've heard that same thing from talking to the different patients that are a part of the NPFE LAN, that they really didn't take it in, the information that was given to them, they really didn't take it in when it was first told, because they were in such shock. It took them a while to start to really comprehend what was being told to them.
Right, exactly. Thank you. Of course. So here's a question for Timmy. It says, "Hi, Timmy. Have any of the patients you've shared the resource with expressed their fears about transplant? If so, what is the main concern?" And that's from Precious.
Oh, hey, Precious. Yeah. Yeah, they have shared. The first concern is what is my life going to be like afterwards? Because it is major surgery. So what's my life going to be afterwards? Okay. And so they're concerned about the recovery time and what happens if the transplant doesn't take right away, because we hear stories about that, and it varies by person, of course. One of the biggest questions I hear from people, though, is about the transplant Medicare, the immunosuppressants. Is if a person doesn't have independent medical coverage and not available to them after the 3 years. I've had a number of patients that have told me that I don't have independent medical coverage, and after 3 years, I lose coverage for this, and so I'm back to square one. So the concern about the process and how the treatment goes through the process, the recovery time for the process, and then the other issue, which is probably even greater than what I just mentioned before, is the drugs that you need to retain the strength of your kidney afterwards.
Great, thank you. Let's see. Jerome, I think maybe this is more for you. Are we able to call the network to see if they have a peer advocate we could have come to our clinic?
Absolutely, I'm sure you can. And some networks have set up a in-center patient representative or peer support groups that your facility may be able to tap into for patient support. So the networks are a great resource for peer support information.
Stephanie, Jerome, if I could add to that answer,
go ahead.
To help with the process, and this is something we've learned over the last 2 years. The more the facility has begun that conversation with the patients, the more effective that peer advocate is going to be when they come. Because if the facilities can, and I don't want to use the word screening, but if the facilities can determine the interest that patients have, it's even more effective if you can have patients that are inquiring about specifics and want to talk to the patient because of the specifics, but they understand the basics already. That way you're adding to their knowledge, and you're talking with the patients. They really want to dig into the process, and you're going to find when it happens also is you're going to find more people that are receptive to the idea of getting on a transplant waiting list. So the more we can encourage that education at the facilities and prepare them to meet with the peer advocate, that is just going to be a home run for all of us.
Great. Thank you. I have a comment that I'm going to share, and it's from one of the networks. It's from Alexandra Cruz. She just had a comment. Can we add that some networks do have the peer mentor programs that they can reach out to and get a patient started, or we can guide them to existing programs for ESRD transplanted patients? So, yes, a good point, Alexandra. Thank you. Again, please contact your local networks. They have a lot of information already available in place for facilities to utilize this peer mentoring. Let's see, we got some more questions here we've got. So a question for you, Timmy. Did Timmy have a living donor transplant?
No, I did not. I had a deceased donor transplant.
Perfect, thank you. Let's see, I think, well, there was a question here, and I think I had two questions here. Do the SMEs get compensated?
The compensation is knowing that we help. And it is.
Repeat that to me.
The compensation is knowing we've helped someone else along the way. And I mean that sincerely. There's nothing more elating to me than talking with a patient and setting their mind at ease about some of the things that they have concerns about, being that example to give them hope that they can navigate this process. And I got to tell you what, and I mean this very sincerely, there's no money you could give me that would take the place of that great feeling I have when I have a patient that calls me afterwards and says, you know what, because of our conversation, I've decided to do some things differently, some things better. So, and I mean that very sincerely when I say that.
Okay, thank you. And I have two of those questions, so thank you so much for just clarifying that. Anything else? I'll just answer this question. This kind of came in. I'm going to sort of summarize it. It says that my facility is under the impression that any and all the materials listed is to be given and distributed to patients. Is that assumption correct? These tools are to be used in conjunction of whatever you may already be using. If you don't have any, we highly encourage you to use some of the tools that you see today. Part of the LAN and part of the requirement, if you are in the project this year, is to implement at least one idea that you saw today in your facility to improve the transplant, patients going on transplant wait list and eventually get transplanted. So as far as the NCC, we're not saying you have to implement everything. We are asking that you take away one or two ideas from today's call and that you can implement. So I hope that answers your question there, Kenny.
Hey, Stephanie, if I could say that also. Yeah, and to that point about, yes, it's for the patients, it's to help assist the patients, caregivers, and staff. But the key is it's also very important that when I hand someone the road to transplant, it's incumbent that I actually review this document with them so it makes sense to them, so they understand. It's not complicated, but it's great to review with people so they understand it. And then the hope is that once they leave and they really understand that document, they go home and have that conversation with their caretakers, their loved ones, whoever they encounter. So it's great to give it to them, but to give it to them without some discussion, we might miss the mark. So that's just the thing I want to share with that.
Oh, okay. Thank you. A question here came in, and I can address it. It was really just sort of general. It just says, how can I get someone from my network to come speak with my clinic? Edward, it's you just reach out to your network. If you do not know who you know who your network is because you mentioned it in here, so just contact them. I would contact them. Usually it's the patient service director that you'd want to talk to at the network, right, Jerome? That would be maybe the person that might get them started for any type of peer mentoring information.
The patient services director, PSD or PSM, patient services manager. Those are the folks that Kim and I usually work closely with.
And is that information on our website that they can find out the phone number of their network?
Yeah, we have ESRD network map that will take you to the website and telephone numbers for all of the 18 networks. And again, that's something that we can include in the resources that we send to all of the meeting participants after the call.
Okay, thank you. I'll be glad to include that when I send that out. So here's a question I think maybe for Timmy. Do you feel it may be too overwhelming if providers, i.e. doctors, nurses, social workers, talk too much to patients at the beginning of dialysis about transplant diagnosis, etc.? If so, how do you feel may be a more time-sensitive approach?
Well, I think it's up to the patient. It's up to, first of all, I guess, let me answer it this way. It's a matter of first knowing the patient. And I was fortunate in my respect that my PCP referred me to my initial nephrologist. They were good friends, and my PCP took the time to share with my nephrologist some of my personality quirks. So when I was talking with my nephrologist, my initial nephrologist, he kind of knew who I was and what made me tick. So I think that's one of the things, of course. But I'll also comment, as I mentioned a few moments ago, is that there is so much that you're given. And when you're told that you have ESRD, And when you're told that and you realize that, you know what, if I don't do something, I may not be here. And that's something that once you digest that, it doesn't matter how strong you are, that's going to have an impact on you. And so some things you're going to miss. So that's why I share the comment that it's great to reach and share information, but then also repeat that information. So it's a matter of the nephrologist and the staff sharing with that patient as much as they think they can retain, but then remember, you've got to do the teach-back method also and make sure they understand what you're talking about, because I really think that's what's happening in some cases, that patients are getting too much information at once. They're not digesting it all. And so when I go to visit or another peer advocate goes to visit and talk about transplant, they haven't retained information. So their answer is, no, I don't know that. So it's just a matter of trying to determine how much did that person retain and then go back and repeat as much as you need to.
Great, thank you. Another question for Timmy. How would you handle it if the referring nephrologist had a negative view of transplant?
That's one that I've yet to meet a nephrologist that was against transplant. I have met some that were not so sure if transplant was the right avenue for their patient to follow. And that's one I want to kind of stay away from, because that means I'm evaluating medical professionals, and I really don't want to do that, to be honest with you. But I think that's something that as a professional, we need to be cognizant of, and maybe bring some of those professionals along the way with us if we see there's a lacking there. But I'm cautious on responding to that any more than what I just said.
Great, thank you. Let's see, it's hard time. Yeah, we got time for a few more. And one question here I can answer real quickly. It just says, remind me what SME stands for, and that's subject matter expert, Ruth. Subject matter experts. So thank you for that. We sometimes use a lot of abbreviations and acronyms, I know. How can we improve communication between transplant and possible donors? Timmy, any insight on that?
There's a course I went to with the network. It's called The Big Ask, The Big Give, and it kind of trained us to help prepare patients on how do you ask for a person to be a donor. Those kind of programs gave a lot of insight for me as to how to ask those questions, and I'm going to guess that other networks probably have something similar to that. And once again, the one here with Network 4 we have is called The Big Ask, The Big Give. And so I'm going to guess that most of the other networks have something like that. So I would reach out to your network to see if they have something available like that gives you the tools to help navigate that process of asking for a donation for a kidney.
Great, thank you.
Stephanie, that is also NKF national campaign. So for those of you looking for information on the Big Ask, just go to the NKF website, and they have lots of resources.
Great, thank you, Jerome. That's good to know. And I'll just answer this question from Kathy. It says, are there going to be posters sent or just pamphlets? Kathy and everybody, we're not sending out anything. We will send you the links to the website that you would be able to print the Partnering Along the Road to Transplant. But we will not be sending those out. But those are, those will be available in English and Spanish, and we will get those links out to you so you can print them at the facility level. And let's see, I think we're about close to the time, and I believe I'm just perusing through them. I just have a question, Timmy, if you don't mind sharing, what was your wait time on your transplant list for your transplant?
When I was diagnosed, I was told approximately 4 years. I was fortunate and came in 6 months under, so 3.5 years. Okay.
Pretty close. So that's good. So anything else before I'm going to wrap up? Anything from Jerome or Timmy today that you want to just highlight again? I think we are nearing the end of our presentation here in our time.
Stephanie, just one thing that I don't want to sound like a broken record, but from my experience in talking to patients, and over the last 2 years in facilities all over Pennsylvania and Delaware, we really need to go back and revisit some of the conversations we have with patients because they're not retaining a lot of information. And as I mentioned the reasons why already, but my encouragement would be that as often as possible to arrange to talk with patients about the transplant process, the wait list process, and I think you're going to find more patients are interested the more we talk about it.
Exactly. Yep, exactly. Thank you. Jerome, anything else?
No, I don't have much, but I am thankful that we were given this opportunity to talk about the NPFE LAN and the work that the patient SMEs are doing on the LAN. The resources that were created by the patient SMEs can be found on the ESRD NCC website under patients, and then click on the NPFE LAN. They are free to use, free to download. Please use them as much as you can. Thank you.
Yeah, well, thank you, Jerome and Timmy, for both taking time out of your day and presenting and sharing all this wonderful information. So I just want to take a few minutes now to close. If your facility has a promising practice related to increasing the number of patients on the transplant list, the NCC would love to hear from you. As we plan for 2020, we have 5 more LANs. We look for facilities to submit names, or your networks to submit names of facilities that have had some really good promising practices. And that's how we get our speakers. These are people who volunteer their time, like you heard today. So if you have some good practices in your facility you would like to share on an upcoming LAN call, please email the NCC info or contact Jerome or myself. We'd be glad to hear from you. I also want to take time to say that our evaluation process has changed, especially if you've been on the calls from last year. If this is new to you, then it's going to be new. But for ones that have been here previously, it's a little bit different CEU process. So please pay attention and listen. We're getting a lot of emails after the call about they didn't get their CEUs and they're having trouble. So 2 things you can do to get your CEUs is if you click on that link right there, it will take you to the survey. But please, when you complete that survey and you hit submit, please don't close out that so quickly, because once you submit that survey, it will take you then to another link that's going to appear, and it's from the Learning Management Center on how to get your CEUs. So sometimes if you just are too quick and you just submit that survey and boom, you're done. The other thing is if you don't want to take the survey right now, you don't have time, approximately 15 minutes after the completion of this call, everybody who attended today will get an email that has the information on how to get CEUs. I've had a couple questions come in today and ask what if there were multiple people in the room while they were on the call together. You can share out that email that you get sent to people who did participate in the call today but maybe didn't register but sat in with you. You're more than welcome to share that. So please share that link out if there's multiple participants in there with you today. Also, if you click on the survey monkey now or at the end of in about 15 minutes, you'll be receiving one. If you want to click on that and get the survey done, and then once it gets submitted, please, do not close out your window. Make sure that you get the link to the CEU process. So a little different, but still, you're still going to get your CEUs, and if you still have trouble, then please email the NCC. But I do want to thank everybody for taking time out of their busy day to join us for our very first 2020 call. We're going to have, like I said, 5 more this year. They're always the third Tuesday of every month at this same time, 3 o'clock Eastern Standard Time. So I think now we're going to go ahead and close a few minutes early, but thank you everybody for attending. Thank you and have a good rest of your day, and hope to hear from everybody on the next call in March. Thank you, everybody. Have a good day. Bye-bye.